Have you ever been shaken awake by someone telling you to stop snoring? Or maybe you've struggled to sleep because of someone else's loud breathing. Snoring isn't just annoying, it could be a sign of a serious health issue. But here's the good news. It can be fixed. Let's uncover how. Welcome to Levitas. What is snoring and sleep apnea? Snoring happens when airflow is partially blocked, causing vibrations in the throat. This produces the harsh, rumbling noise that keeps people awake at night. It occurs when the tongue, soft palate, or throat tissues relax too much, narrowing the airway. While snoring can be harmless, it is often linked to sleep apnea, a condition where breathing completely stops for seconds or even minutes. Obstructive sleep apnea, or OSA, is dangerous because it reduces oxygen supply, leading to poor sleep, fatigue, and serious health risks like high blood pressure, brain and heart disease. Identifying and addressing snoring early can prevent serious complications. How can sleeping on your side help? Sleeping position plays a major role in snoring intensity. When you sleep on your back, gravity pulls your tongue and throat tissues downward, partially blocking the airway. This increases air resistance, making snoring louder and more frequent. Switching to side sleeping helps keep the airway open, reducing the chance of obstruction. This simple adjustment can make a huge difference, especially for people with mild snoring or sleep apnea. If switching positions feels uncomfortable, body pillows or specialized sleep aids can help maintain a side sleeping posture throughout the night, leading to quieter, healthier sleep and a repairing rest. Can losing weight help? Excess weight, especially around the neck and throat, is a major cause of snoring. Fat deposits in the upper airway create narrower breathing passages, making it harder for air to pass through smoothly. This increases tissue vibration, producing loud snoring sounds. Losing even 5 to 10% of the body weight can reduce airway restriction, leading to easier breathing and less snoring. Weight loss is particularly important for those with obstructive sleep apnea, as it can significantly decrease the symptoms. To lose weight effectively, focus on a balanced diet rich in high-quality lean protein, fiber, and healthy fats. Avoid processed foods and excess sugar, which contribute to weight gain and inflammation. Regular exercise, especially cardio and strength training, also helps improve muscle tone, preventing airway collapse. By shedding extra pounds, you can breathe easier, sleep better, and stop snoring naturally. Can alcohol and sedatives worsen it? Alcohol and sedatives are major culprits behind snoring. These substances relax the muscles in your throat, tongue, and soft palate, causing them to collapse into the airway. This restricts airflow, making breathing harder and increasing vibrations that lead to loud snoring. Drinking alcohol, especially before bedtime, worsens airway obstruction and makes snoring more severe. Even people who don't normally snore may start after consuming alcoholic beverages. Similarly, sedatives and sleeping pills relax the throat too much, leading to louder, more frequent snoring episodes. To reduce snoring, avoid alcohol consumption, especially in the evening hours. If you rely on sedatives for sleep, talk to a doctor about alternative treatments, such as cognitive behavioral therapy or natural sleep aids like melatonin or adaptogens like ashwagandha. Instead of alcohol, drink herbal teas like chamomile or valerian root, which promote relaxation without muscle over-relaxation. Staying hydrated also keeps the throat lubricated, reducing snoring. By cutting back on alcohol and sedatives, you'll experience deeper sleep, reduced snoring, and better overall health. How can quitting smoking help? Smoking irritates and inflames the airways, leading to swelling and congestion. This causes narrowed breathing passages, making it harder for air to flow smoothly. The result is louder, more persistent snoring. Cigarette smoke also damages the cilia, the tiny hairs in the nose and throat that help clear mucus and debris. When these hairs stop working properly, mucus builds up, further blocking airflow. Chronic smokers often develop thicker throat tissues, which contribute to snoring and breathing difficulties. Quitting smoking improves lung function, reduces inflammation, and clears mucus buildup. Many ex-smokers notice a dramatic reduction in snoring within weeks. The sooner you quit, the faster your airways recover. If quitting feels difficult, consider nicotine replacement therapy, behavioral counseling, or support groups. Staying active, drinking plenty of water, and using steam inhalation can help clear congestion during the transition. By eliminating cigarettes, you'll not only reduce snoring but also breathe better, sleep deeper, and protect your overall health. What nasal issues worsen this condition? Nasal congestion, deviated septums, and chronic allergies are major causes of snoring. When the nose is blocked, airflow becomes turbulent, forcing you to breathe through your mouth, which increases throat vibrations and intensifies snoring. A deviated septum, where the nasal passage is misaligned, can also make breathing difficult, leading to persistent snoring. Allergies cause inflammation and mucus buildup, worsening the problem. To fix these issues, start with nasal rinses like saline sprays or neti pots to clear congestion and allergens. Using a humidifier can prevent dry nasal passages, reducing snoring. For allergy-related snoring, try antihistamines or nasal remedies. If you have a deviated septum, minor cases can be managed with nasal strips, but severe cases might require surgery. Correcting nasal obstructions significantly improves airflow, making breathing easier and reducing snoring naturally. Can sleep deprivation worsen it? Lack of sleep leads to muscle fatigue, making the throat muscles collapse more easily. This increases airway blockage, causing louder, more frequent snoring. Poor sleep quality also triggers inflammation, which further narrows the airways. To fix this, establish a consistent sleep schedule, aiming for 7 to 9 hours per night. Create a relaxing bedtime routine, avoiding screens and caffeine before bed. Use blackout curtains and white noise machines to improve sleep quality. By prioritizing restful sleep, you can significantly reduce snoring and wake up feeling refreshed. Why you should elevate your head. Sleeping with your head elevated helps keep airways open, reducing snoring and sleep apnea symptoms. When the head is flat, gravity pulls throat tissues downward, restricting airflow. Elevating the head and upper body prevents this, allowing for better breathing. To do it properly, use a wedge pillow or adjustable bed to maintain a comfortable incline. Avoid using multiple flat pillows as they can strain the neck and worsen breathing. If snoring persists despite these changes, consider consulting a sleep specialist to rule out underlying conditions. By making these adjustments, you can enjoy quiet, uninterrupted sleep while keeping your airways clear and healthy. In conclusion, snoring is more than just an annoying nighttime habit. It can be a sign of serious airway obstruction. When the throat tissues relax too much, airflow becomes restricted, leading to vibrations that create snoring sounds. In some cases, it may indicate obstructive sleep apnea, a condition that interrupts breathing and causes oxygen deprivation, increasing the risk of fatigue, high blood pressure, and heart disease. Fortunately, making simple lifestyle changes can dramatically reduce snoring. Sleeping on your side instead of your back keeps the airway open, preventing throat collapse and making breathing smoother. Weight loss is another powerful solution, as excess fat around the neck narrows the airway, making snoring worse. Even a small reduction in body weight can lead to better airflow, quieter nights, and a repairing sleep. Certain habits and substances also contribute to snoring. Alcohol and sedatives overly relax the throat muscles, increasing airway blockage. Avoiding alcohol intake, especially before bedtime, can make breathing easier. Similarly, smoking causes inflammation, congestion, and airway swelling, all of which worsen snoring. Quitting smoking reduces mucus buildup, improves lung function, and enhances overall respiratory health. Other physical factors also play a role. Nasal congestion, allergies, and deviated septums create blockages, forcing mouth breathing, which amplifies snoring. Treating nasal obstructions with saline rinses, humidifiers, or medication can greatly improve airflow. Sleep deprivation itself worsens snoring by increasing muscle fatigue, so maintaining a consistent sleep schedule is crucial. Elevating the head while sleeping also helps by preventing airway collapse and ensuring steady breathing throughout the night. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.